This is Dawn Renee Jose, and I am the owner of VerVita and also Contact Reflex Analysis. My father was the founder and developer of that technique. And we are here today talking to Dr. Sam Riley, who is one of the first Contact Reflex Analysis certified practitioners. You were one of the wonderful people that said, hey, I want to get on board and get certified. You did the work and you have been going great guns ever since. So I just want to welcome you and thank you for doing this interview with me.
Thank you for having me. I am a chiropractor. I practice in Massachusetts currently, which may be slightly changing. And I went to New York Chiropractic College. I graduated 2017, I believe. And my background before that, I went to University of Rhode Island. I specialized in kinesiology, exercise science was my bachelor's. So I always knew I wanted to do something with the human body. And just with my upbringing, I had a lot of injuries, a lot of athletes, probably do the same, but just a lot of recurring injuries. I was orthopedic to surgery, did all the physical therapy, came back, hurt again, orthopedic, surgery, physical therapy, did all the work, came back, and it wasn't working for me. So I was just on the computer, I was looking at scope of practice for different disciplines in the health world, and I came across chiropractic, and I said, okay, it just looked like I had this, kind of a whole person approach at my fingertips with that. And I just went there without ever going to a chiropractor. I'd never been adjusted, and I just went to chiro school. It just felt right. And I'm in chiro school, and I don't know any of this stuff exists, any of the frequency medicine, the muscle testing. And my first year, I ran into a couple of classmates who their parent had been doing this for about 40 years, some of the applied kinesiology and the muscle testing. So between that and my biochemistry teacher, that was my first introduction to it. And even after graduation, I was practicing 2 years in New Jersey. I found a guy I really liked. I still didn't know about CRA, had no idea it even existed. And we're doing a couple other techniques that we had some similarities with. And Dr. Hoper started playing me videos of your dad. And so he played like the Tampa DVD. And just as soon as I heard 2 words out of his mouth, him just start talking, I was like, this guy is different. And just the concepts that he would talk about 30 years ago are what a lot of people are dealing with today. And I was just captivated by every word, and I would just sit and watch it and watch it and watch it. And then I decided to go. Dr. C.J. Cooper in Iowa was my first at CRA 1. And then I believe I saw Dr. Charlie for CRA 2. And then I've been back 3 or 4 more times probably since, maybe more. It changed the whole trajectory of the way I practice and my practice in general. And what I love about CRA, if I could only practice one technique for the rest of my life, it would be CRA, because it really takes into account the whole person. So you look at whatever issue they're coming in with, whether it's joint pain or headaches or Lyme or endometriosis, doesn't matter what it is. The system guides you to where the biggest urgency is, where the priority is, where's the fire, where do you need to start? And that's the beauty of it. And it takes into account the whole person. So the structural aspects of health, the emotional aspects of health, which is astronomical for everybody, and then the biochemistry. And so you can support the whole person through that approach. And I just think it goes the deepest. I think it's a book too. The book in this saying, the body keeps the score. And I think you get all that information with CRA.
Why would you recommend a health professional take or learn CRA if they already have multiple techniques?
So the best way, I've had this explained to me, and I think it's perfect, is CRA is like your computer. So whether you're a Mac or a PC guy, right? It's the MacBook, it's the Windows, so it's the system. And then all your other techniques would be programs within your system. Or even if you think about it, just even simpler from your phone, like your phone would be CRA. And then all the apps on your phone would be all your other techniques. So whether you do neuro-emotional technique, or you do applied kinesiology, or you do Leibowitz, or you do quantum neurology. So all these other techniques and healing modalities that you can do, you can now integrate that and organize it all through CRA. So you can see where the biggest urgency in the body is. And let's say it goes to an imbalance with the kidney. You can then say, okay, what are the structural components that are affecting the kidney? And if you have some applied kinesiology or different other muscle work techniques, you can integrate that into your system. If you have different emotional pieces like emotional freedom technique, EMDR, tapping, NET, anything you do from that route, you can organize that into the system. So you can already take what you're doing and you can just organize it and you can make it more effective.
Would you say that with CRA, you are able to figure out which of your tools is the necessary tool
Absolutely.
for the time?
The big thing you have to remember, anything can cause anything. So somebody can come in and their kidney can be out of balance and maybe they need some nutritional support like Cir-Q Tonic. Maybe they need to do a lot of emotional clearing with, feelings of fear and overwhelm and paralyzed will and things like that. But the body will tell you. And so you just have to ask the right questions because you can't fix what you can't find. And so CRA takes you right there. It's a roadmap. It says, okay, this is what we have to fix first. This is the biggest issue that we need to support first. And then you can go down the line. And the other part I love about CRA is the scoring system. And the scoring system tells you everything. You get so much information just from one simple little number. And you can see if there's too much energy somewhere or if there's too little energy somewhere. If the patient can handle a detox right away, or if, hey, we need to really support the body, build up their constitution, build up their strength first. So it tells you too what state the organ or the imbalance that you're working on is in and where you need to go with it. And then you can also monitor progression. Patient comes in next time, okay, well, this is where we were. How is it today? How is it now, 6 weeks, 8 weeks later when you see them for the follow-up? You can also see with the numbers, and a lot of the patients who are going to see this are going to know it too. You can see correlations. So how certain imbalances are affecting other parts of the body. And you just get so much information just from one little number, as you know.
Absolutely. I love the scoring part. That's about my favorite part of it because of the so much information. And it's very helpful in understanding, okay, here's the problem. You get to focus in on the problem, but then what do you do to bring it into balance? Do you do X, Y, Z, or even more? But you can score it to figure out which technique, which tool, which nutrition, essential, whatever it is, to bring it into balance. So yeah, I love that part too.
Even standard, even if you just do standard chiropractic, just a lot of musculoskeletal work. Somebody comes in with hip pain, you can focus on that hip pain and see all the different pieces that are affecting that hip pain. Okay, there's some structural work we got to do, some muscles we got to activate and turn on. We'll get into some other stuff, but different emotional pieces you have to clear. And then, okay, maybe they are deficient in certain nutritional or essential oil, herbal remedies, things like that, and we need to supply it there. So it just gives you, it kind of like rolling the red carpet. Like, all right, this is what you got to do. Do this first, and then you can go to this.
I love that analogy, rolling out the red carpet. And no matter what your profession is, you had said, even if you're a straight chiropractor, roll out that red carpet, give people exactly what they need, the right thing at the right time. So if the body indicates it needs nutrition, then plugging in the VerVita products, can you even choose? What is your favorite VerVita nutritional supplement or essential oil, or do you have a favorite?
I think most people would probably already know that. Nutrition product, and when nutrition comes up for me, VerVita's just plugged in. There's nobody else. So Cir-Q Tonic for sure. And if I had to pick an oil, probably immune harmony, although you have kind of changed me a little bit with favoring present moment a little bit more as well. So, but Cir-Q Tonic and immune harmony. And just, I think anybody, I don't care what age you are, how old you are, what state of health you're in, can pretty much benefit from Cir-Q Tonic because it just does everything. And one of the biggest things with CRA in particular too is the bladder. And I'd go to all these trainings, all these seminars, all these different techniques, and nobody ever talks about the bladder except for CRA, and that's the first time I've ever heard about it. The bladder is the holder of all unresolved emotions, and it's also the head of the immune system. So these are what so many people deal with on a day-to-day basis. And Cir-Q Tonic is nutrition for the bladder, nutrition for the kidneys, for the liver, for the gallbladder. So detoxification in a bottle. And we live in such a sick world today that I just think it's almost needed, almost as like somebody would take like a multivitamin for. We're around so much alike, I'm sitting in front of the computer right now. People who sit in front of the computers all day, all the kids who have their iPads on their laps all the time. People are wearing the wireless headphones now, and just so much EMFs and radiation. And Cir-Q Tonic is ridiculously good at neutralizing radiation in the body and just hydrating the body. And I feel that probably close to 90% of the time when I'm seeing a new patient for the first time, it doesn't matter where they've been before, most of the time it's starting in the bladder. And just like you would do for a math equation, you would do, multiplication and division before addition and subtraction. I just think that that's how the body prioritizes, obviously the heart as well, but the bladder, it's like, okay, if this isn't good, we got to get this in check first before we go to anywhere else. So I think when a lot of people are like, oh, I'm so overwhelmed with information, I don't know where to start, where do we go? I think the bladder is a really good spot. And, all these symptoms that people deal with that, Dr. Versendahl had just kind of given them the roadmap to, like all the dry heels. And I feel like everybody has that. And just a lot of people have the infection in there. A lot of people have detox issues and need additional support. A lot of people have sugar all the time, and it just depletes their B12 and their immune system gets compromised and they get sick. And everybody has these skin issues and all these diagnoses with, anything in the itis family, the colitis, the cellulitis, the vasculitis, all these inflammatory conditions that Cir-Q Tonic can really help with.
I would say it's a genius product. Maybe I'm a little bit biased on that one, but when my dad put that one together, it's phenomenal. And still, I'm amazed. I've known it since we started in 2009, but I am still often amazed at what it can do. I mean, the capsules are so tiny, but yet it packs such a big punch. I was talking with somebody, it was online, but how are heels connected to the bladder? Going, well, when your bladder, it has a lot of toxins in it, and you had said the bladder is the holder of all unresolved emotions, Dr. Versendahl quote there. All those toxins and things back up, and your skin is one of your biggest detox organs. So when your body gets overwhelmed and can't handle it, what happens? It starts coming out your skin. You got skin issues, and the heels are really big on that, and they can get dehydrated and dry because of those toxins. So really, we're still working. We're not taking Cir-Q Tonic to heal heels, right? But we're going after the cause of what's making the heels crack.
Well, you just said overwhelm.
What's that?
And you just said overwhelm. So that's the oil for the kidney and bladder. So just like I just said, Cir-Q Tonic is nutrition for the kidney and bladder. The immune harmony oil, that's the oil for the kidneys and the bladder. And I feel a lot of times too, emotionally, people will do really good in those baths and the foot baths. I think they are extremely powerful. And I don't want to say a non-believer, but I think when I took my first CRA, I was like, oh yeah, essential oils, so what, big deal. And then I had my first bath with it and I was like, whoa. And people, their bodies are overwhelmed. They're emotionally overwhelmed to varying degrees on a day-to-day basis and just life stressors. And when you're in that bath or in that foot bath, you are doing a huge emotional detox for your body. So, if you can take a bath, depending on your frequency, once every week or 5 days or whatever you end up with, you're just doing a big emotional release each time you're in that bath. Almost like if you were to have like a talk therapy session, is what I would compare it to, and what a normal American might think of it. But a huge weight lifted. You should feel very light after and just relaxed and just zen-like. And I just really think it's a good way to put the body in that parasympathetic, rest, digest, safe healing state as well.
And I will say you had picked Immune Harmony. That can also support the adrenals. So if you do take a bath, I recommend, I don't know if you've ever had it. I've had it where I've taken it just before bed, and I had quite a few drops really in the bath, but my adrenals were like, yeah, let's roll. I mean, it was a great response, but not just before bed. I did a whole lot of work between wanting to go to bed and 3 a.m. I got a lot done. But have you ever had that with Immune Harmony?
Personally, I haven't seen that or had patients complain about that. I think a lot of them will take it at night because most of them too will have kids, and it's like, oh, it's the only time I get, to myself after I put the.
Mhm.
I think the two biggest important things is make sure you're hydrated always, but on bath day, especially make sure you're hydrated, and then make sure you've had food in your stomach within the last couple hours. Because if you go into any bath dehydrated, no food in your stomach, low blood sugar, your body's going to know about it. And so that would be one. But I also think too, like really good for the lymph and just any type of skin issues. And people do really good, especially like the toenail fungus does really good with immune harmonies. You get the detox, you got the tea tree oil in there for the fungal component. I don't necessarily see that. Most people, even if they fight me sometimes. It's like, oh, will you do a bath? It's like, oh, I don't want to sit there by myself in my own filth. I've heard all the excuses, but as soon as they get in there, sometimes they'll email me the next day like, hey, I know you only said once a week, but can I do 2 a week? And people, I think it really just helps them relax.
With contact reflex analysis, we score everything. We get the exact amount for a bath that person's body needs. But I also know there's a lot of people that just go, I want the benefits of this. I don't want too much because I don't have somebody that can score it out for me. What would you recommend?
Usually what I've been seeing the last like year and a half, 15 to 20 drops per 50 pounds of body weight and a half to a cup of Epsom salt. So like if you have, a 50-pound individual, they can, and again, you can start a little slower and work your way up too. But if you can generally do, if you have a 50-pound kid, 15 to 20 drops of an oil with a half to a cup of Epsom salt. And I think that's usually a good starting point. So you can convert it from there. If somebody's 150 pounds, they could probably, do up to anywhere from 45 to 60 and, 2 to 3 cups of Epsom salt. And minute wise, I'd say it varies, but I'd say most of them are between 20, 30 minutes, anywhere in there.
Like you said, start with less. It's easier to start with less. I know I have little ones and grandkids, and we'll put 1 or 2 drops of the oil in their bath, just 1 or 2. And this was when they were months old. Now I have a 1-year-old and a 2-year-old. So now it's maybe up to 5 drops, something like that. But I score it. I'm able to test exactly what they need. So you can always start with less and go from there. People love stories and to hear what you've done and the results people have gotten. Do you have any of those aha? Oh my goodness, I love this story.
I mean, there's a lot that I don't want to say miracles, but just
Hmm.
really big shifts really quickly. Like personal story for me, I said I had practiced in New Jersey for the first 2 years. I found out probably about a year or so in that I had mold in my apartment that I was living in. I think this is, a big thing for a lot of people. And, I was getting sick every other week. I, was missing work a couple days a month, having to call out, unable to, I was really down, really depressed, just miserable, and just like emotionally just very reactive. So just even like the tiniest little things would just make me just like really angry. And finally figured out that I had mold in my apartment, got that remedied, got out of there. and I had been trying all these different protocols and, seeing all these different people, my old chiro I had worked with, and nothing was touching it. I was having some skin stuff and just mentally not feeling where I wanted to be, some digestive things, with detoxification, liver, gallbladder things. And I believe it was one of Charlie's protocols was like kind of like I think the mod 2, I think it was. I got a protocol from him. I think it was the first time I met him. And, he did everything CRA, just went right in. Okay, where's the biggest issue? Where do we need to start? What do we need to build up on? And that was the very first time I had anything touch my issues. And that was kind of like the light bulb moment for me, like, oh, because before I would go in and I would have no, I would have my testing and different procedures and things that I would do. But now it's like, okay, now I know exactly what to do. I know exactly where to go. So it just gives you like the roadmap of the body and where you need to start, what needs to be supported, where you need to go next, how things are progressing. And a lot of my skin stuff was probably 75% better within a few weeks. And then it was fully resolved within like 4 or 5 weeks. So it just really showed me the power of CRA. And from that point on, after that seminar, I kind of changed the entire way I practiced.
People are going to hear your story and they're going to go, I deal with mold. I deal with this. What did you do? Now, obviously it was specific for you, but is there anything out of what was specifically done for you that is, you know, it's utilized a lot for people with these situations?
So from VerVita, well, counting SRT, uh, Cir-Q Tonic was in there.
And that would
Immune,
be for liver detox, liver, kidney,
yep.
bladder. Yep.
Immune Harmony oil and black cumin seed oil. And I believe Immune Harmony oil was foot bath and black cumin seed oil was by mouth.
Okay.
Also really good for the fungal digestion, hormones.
And then you mentioned the SRT. I don't think I've talked about that with anybody else at this
No
point.
SRT yet?
Did you want to talk about SRT at all?
Well, my patients know I wear two SRT optimizers, the blue lights, in my pockets all day while I'm treating. And I will always treat with the long light. So they'll see the green light every visit. It's magic. It emits the frequency of a healthy cell. And I think like we talked about with immune harmony, everybody is so overwhelmed. Everybody is so stressed all the time, and everybody's in fight or flight in that sympathetic dominance. And you're not going to heal when you're in that spot. So what I think SRT does the best is it takes people out of that and puts them into that parasympathetic rest, digest, safe healing states. And now the body can begin to heal. And especially you'll see it a lot with different structural issues and just people who are vibrating at a real low frequency, a lot of chronic disease patients, but everybody can benefit. When I'm wearing those in my pocket all day, I'm charging myself. My energy stays high. That patient is getting blasted with that healthy cellular energy the whole time. You'll just see them yawning, or a lot of the patients who bring their kids in who have like ADD or hyperactive, they're like, oh my gosh, why is, little Johnny so relaxed on the table? What are you doing? And so they're just getting blasted with that energy all day. So you're working at the cellular level, the mitochondria, almost like a stem cell treatment.
It is pretty powerful technology. And it's called, the SRT stands for sympathetic resonance technology. And there is, and I can post the link to it, but there is training on what it is and how to use it. Do you give that to your patients when you?
Yeah, a lot of people will always ask me too, what I think would be the best for them.
Sure.
I think that for most people it would be the optimizer, I'd say,
Mhm.
because okay, you don't have to be intentional when you're using it, right? You can just put it under your pillowcase when you sleep, just lay it on your, belly or bladder, or while if you're watching TV, or a lot of women can just wear it right in the left side of their bra, right over their
Yep.
heart. Organ flushing with the long light. I'll have a lot of people watch Terry and CJ Cooper's video on YouTube,
Mm-hmm.
organ flushing. But if they have a long light and they can organ flush, especially if they have just like stagnation and constipation and things are just really sluggish all the time, and even just a lot of physical pain. If they can do that a few times a week, I do it almost daily. And that I think has been the biggest game changer.
I like to give the picture of, your garbage disposal. You're trying to dump things down the garbage disposal, detox, getting rid of it, right? Neutralize it and get rid of it. Well, if you're putting too much in the garbage disposal at once, it can get backed up and stuck. Then that's what our bodies do too. Our liver, our kidneys, bladder can't keep up and it just gets stuck. Well, that's when organ flushing comes in too, pressing into those reflexes, those areas of the body, and sending energy in there so it kind of opens up the energy to release it and so it can flow through.
And you said the bladder too, and I think that's one of the biggest concepts that is so important for people, because everybody talks about the gut and the gut and the gut. And when you have all that toxicity and things are backing up, a lot of that kidney bladder flora imbalance now spills over into the intestines. So even if people are coming in with all these gut issues and people are going right to the gut, that's why too, a lot of times, if your kidney bladder flora is not in check, your gut flora is going to be out of check. And that's why too, I just think it's so important. So if everybody always asks too, it's like, I'm so overwhelmed with information. I think I have Lyme, parasites, I have all these things. What do I do? Where do I start? Usually I'll say the bladder for most people.
I think that's a great place to start. I mean, because even if you're working up, you have to be able to release all the way down. And if you're stuck down, if there's a blockage down there, energy blockage, it's not going to pass through. You post a lot of really good Instagram, social media information for people too. Very valuable, educational.
Hopefully I have a little more time to do some more stuff for you guys coming up in the future here.
There's always something to do. You're never going to be bored.
Never. That's the beauty of CRA. Everybody's an open book.
Well, thank you very much for doing this, and I appreciate you. And for right now, we'll just say goodbye until next time.